So, for the problem statement, about 30% of individuals who are diagnosed with COVID 19 have persistent symptoms that extend 3 weeks beyond the initial onset. And this is referred to as long COVID. And as you can see from this graph on the right, there's a vast array of lingering symptoms that often affects multiple organ systems. And some of these common symptoms include fatigue, shortness of breath, and joint pain. And in addition, the long-term physical and psychosocial effects of COVID-19 are really not well understood, but this is needed to provide better resources and support for these patients. And as we all know, maintaining good mental health during the pandemic has been difficult for just about everyone. And it's particularly challenging for these patients with long COVID due to their ongoing symptoms, having to social distance, loneliness, among many other effects of the pandemic. Next slide. So to mitigate these problems, our team sought to, first of all, provide ongoing support and resources for patients with long COVID through a mobile app. And then second, to assess the long-term physical and psychosocial effects of COVID-19 through a clinician researcher dashboard. Next. And so these are the design requirements for our mobile app. So we wanted patients to be able to track their symptoms, connect with other long COVID individuals for some social support, learn about clinical studies and trials for long COVID, and also access educational materials and resources, as well as being able to connect with their care team. Next. And the design requirements for the dashboard were to allow clinicians and researchers the ability to view patient symptoms and to integrate the data within the electronic health record, which is a system that contains all of a patient's medical history and information. Next slide. So the first part of the platform is the patient-facing app here. The app leverages the Stanford BioDesign Cardinal Kit, which is that framework that uses Apple Research Kit, Health Kit, Care Kit, and Google Cloud Services. So in our app, patients complete surveys and they have the ability to share their health data with the app. And these data are stored in Google Cloud Firestore and then BigQuery so that we can do analytics. And patients can also input any symptoms that they're experiencing. And these free text symptoms are mapped to clinically validated medical concepts using the Google Healthcare Natural Language API. Next. And so at the bottom here, this is just an example of how various patient free text inputs might get mapped to a healthcare code like fatigue using the Healthcare Natural Language API. And it's useful to map these unstructured text to a healthcare code like this so that we're able to query and do some analytics on the data. Next. So the second part of our platform is the clinician researcher dashboard, which is hosted on Google Cloud using App Engine. The dashboard uses a Smart on Fire API, and this is from Boston Children's Hospital, and it allows secure health data exchange between the app and the electronic health record. And this is important because it allows clinicians and researchers the ability to visualize the survey responses and symptoms, which could be used to inform a patient's care plan and to better understand the long-term symptoms of COVID-19. Next. And so this timeline shows the progression of the mobile app and dashboard since the initial prototype was developed at the Stanford BioDesign Building for Digital Health Build-a-thon. So in November, we began meeting with Sham to establish the architecture on Google Cloud. And then in January, we developed the app, surveys, visualizations, and the user interface with Cardinal Kit. And then in March, we started developing the integrated electronic health record dashboard using the Smart on Fire API. And then for our future directions, we've listed several possibilities here, including developing an Android app, validating the healthcare API symptom mapping to ensure that patients' free text inputs are getting mapped to an appropriate clinical terminology. And we would like to deploy the app at a long COVID clinic, as these are starting to pop up across the US, to assess how feasible and usable it is for patients and clinicians. And then beyond COVID, we would like to expand the platform to other health-related use cases where it's necessary for patients and their clinicians to monitor patient-reported symptoms and functioning over time, such as for diabetes. Next slide. And thank you so much for listening. Special thanks to the organizers, the Google team, the Cardinal Kit team for making this platform possible. We've really learned so much about Google services, especially the healthcare API, and we've also met many collaborators worldwide throughout these past couple of semesters. So you can check us out here on our website. You can find us on GitHub, and please feel free to email us. And now we'll show you our demo video. Before a patient joins the Long COVID-19 platform, they can learn more by going through the following onboarding steps. During each step, they'll receive some information about the purpose of the app and how their data are used to help them decide if they would like to provide consent and join. So let's get started. Data are gathered through weekly symptom surveys, and the person has the ability to share their Apple Health Kit data, such as from a medical record or their physical activity. We have a privacy policy that they can review, and all data are stored in Google Firestore and BigQuery. The data are stored securely and are not used outside of our research team. The time commitment is minimal, and we estimate it will take about 5 minutes to complete each survey. We give them more information about the survey here, and they can withdraw from the study at any time. So this is the full consent form that the person can scroll through, and then they can agree to be part of the study. The person then signs the consent form by inputting their first and last name, followed by their signature. Once they have consented to join, they then register with a username and password. This is followed by logging in with that username and password. They can also set up a passcode that is entered each time they use the app to protect their health information. They have the ability to contribute their activity data to help us study the long-term effects of COVID-19. And they can also contribute their Apple Health records. They can choose which part of their health record is shared, such as their allergies, clinical vitals, or other conditions. And then they can decide how they would like to share new records every time they see their doctor. So following the onboarding process, there's a warm welcome message, and we ask them to get started by completing a one-time background survey, which asks about their sociodemographics and clinical characteristics, such as when they were diagnosed with COVID, if they've had the vaccine, and any comorbidities. The symptom survey is scheduled for them to complete each week, and I'll start that now. This survey is an open source National Institute of Health Global Health Survey. The person rates various aspects of their physical and mental health on a 5-point Likert scale. And after answering the 10 questions in the survey, they can also enter any other symptoms that they might be experiencing. And we're planning to use the Google Healthcare Natural Language API to detect these symptoms written in free text responses and then map them to clinically validated medical terminologies to group related symptoms together. On the dashboard tab, patients can view their survey responses over time. They can also expand their chart by zooming in. And they can also compare their physical and mental health survey responses to the data that they share from Apple Health, such as their steps or sleep data. On the Resources tab, this contains some information about points and rewards to try to engage patients in completing their weekly surveys. Each time they complete a survey, they earn a badge, such as the Night of Hand Sanitizer. They can also access resources for clinical studies and trials related to long COVID, community forums or online support groups here. And they can also contact a member of their care team, as these patients often have multiple specialists involved in their care, such as a primary care provider, infectious disease specialist, or a pulmonologist. Lastly, on the Profile tab, they can change their preferences, view the consent document, or withdraw from the study. This app is the first component of the Veranos platform. The second part is the clinician dashboard here. The dashboard can be integrated within an electronic health record, as we've simulated here. This is a custom dashboard that we built after the BioDesign Cardinal Kit Build-a-thon, and it's also hosted on Google Cloud Platform using App Engine, BigQuery, and the Healthcare API. We also use the Smart on Fire API, which allows data from our app to be securely exchanged and compatible with nearly any type of EHR. On the dashboard, we can see the overall trend of our patients' composite physical and mental health scores that are reported each week. We can also view a log of symptoms that are reported by our patient. Here we can see that the patient has reported fatigue in the free text in the survey, which is mapped to a healthcare ICD-10 code here. And each instance of fatigue is shown by a red box. Getting data from outside of the electronic health record has been very challenging for the healthcare industry due to a number of technical and clinical challenges. This is important because it allows clinicians and researchers to access the data collected from our app in combination with the patient's health record to inform medical decision-making, and perhaps the clinician could also contact the patient when their symptoms are worsening. Our work is publicly available on GitHub and contributed towards the open source framework at Stanford's Cardinal Kit for other healthcare developers to use as an initial starting point. And this could be tailored to other health conditions beyond COVID-19, such as hypertension or diabetes. We plan to deploy our platform at a long COVID clinic to assess how feasible and usable this is for patients and their clinicians. Thank you everyone for listening, and we're happy to take any questions.